Investment in a company that I believed was developing a breakthrough concussion drug I thought would help others. And I'm sure you'll understand why it's too late for me, because I've recently been diagnosed with Parkinson's.
Hall of Famer Brett Favre, one of the greatest quarterbacks of all time, made a shocking revealing the diagnosis of Parkinson's disease. Many are now wondering if his illustrious football career played a role, and if so, what is the connection? Welcome, YouTube. I'm board-certified internist Dr. Dre, and today we're going to discuss the announcement he made to Congress, but more specifically, we're going to delve into the connection between concussions, CTE, and Parkinson's. Now, head injuries or traumatic brain injuries, as well as their complications, have been known for some time. Yet, the announcement by Brett Favre does shine a light on the subject matter. Cognitive issues associated with head trauma predate all of this. It predates Will Smith's movie Concussion, as well as Aaron Hernandez's CTE diagnosis and Muhammad Ali's Parkinson's diagnosis. In fact, the first description of anything like this was a neuropsychiatric phenomenon seen in 1928. It described symptoms of brain damage seen in boxers. Maybe you've heard of the term punch drunk? Yeah, that's exactly where it comes from. And these boxers displayed symptoms of confusion, disorientation, slurred speech, poor coordination, and erratic behavior. And this is what we describe in CTE. CTE, or chronic traumatic encephalopathy, is a neurodegenerative disease related to brain trauma. Well, neurodegenerative diseases are basically the deterioration of the brain and the spinal cord over time. Common neurodegenerative diseases such as Alzheimer's and Parkinson's can occur as complications of CTE. Well, how does this all happen? The simple answer is acceleration and deceleration of the brain. Think about the brain moving fast in one direction and then coming to a almost immediate stop. So your brain floats in fluid in your skull. And when you get a significant hit or significant trauma, your brain accelerates in one direction and then again quickly stops as it decelerates against your skull. Now repeat this a couple hundred times, and you get the accumulation of brain bruising, as well as micro bleeds and structural changes. Of note, in a 2018 interview, Brett Favre did state he may have had hundreds, if not thousands, of concussions.
Brett Favre says he has no idea how many concussions he's had, but the gunslinger and Packers legend admits the concern of long-term health, that's real.
But on a cellular level, what is exactly happening? What is the insult that we are actually seeing? Well, one of the first things is chronic inflammation. Head injuries trigger a response, an immune response, and an inflammatory response. It also causes oxidative stress, the buildup of free radicals, which on their own cause damage to cells and structures around the brain. The last thing is it causes abnormal folding of structural proteins in the brain. So I just want to take a few minutes to discuss these abnormal proteins and how they play a role. Neurons in your brain have structural proteins that help make up the actual brain. And repeated head injuries cause these proteins to fold abnormally. These proteins then clump together and accumulate and disrupt the brain's normal function. And all of these mechanisms, again, the inflammation, the oxidative stress, and the abnormal protein folds give us the symptoms we see in CTE. The symptoms are motor symptoms. So, for example, abnormal movements, cognitive impairment, abnormal thoughts, inability to remember things. That's something you will see, as well as mood disorders and behavioral problems. That being said, how do we make the diagnosis of CTE? The diagnosis of CTE is complex. It relies on a combination of clinical evaluations, neuropsychological assessments, and neuropathological findings, all taken together to make an educated guess. However, definitive diagnosis of CTE at this time can only be made by a brain autopsy. So only upon one's death can a definitive diagnosis be made. Parkinson's disease. Now, we have discussed CTE, but how do we get to Parkinson's? Remember, Brett Favre's announcement did make it seem like his football career and concussions were related to his diagnosis of Parkinson's. So first, let's define it. Parkinson's disease is a progressive neurodegenerative disease that predominantly affects movement. The disease typically sees destruction of dopamine neurons that play a crucial role in movement and mood. The 4 primary signs and symptoms in Parkinson's disease are bradykinesia, slowing down or difficult movement, tremors, involuntarily shaking, and this is seen in the hands and feet, rigidity, stiffening of the muscles around the joints, and postural instability, basically difficulty balancing and having frequent falls. In the general population, Parkinson's disease is seen in about 0.3% of the population. However, with those with traumatic brain injuries and CTE, it occurs at a much higher frequency. So why does this happen? Well, it's kind of similar to what happens, or the mechanisms, in CTE. Accumulation of abnormal proteins, inflammation, and oxidative stress. However, in this situation, it is the destruction of dopamine neurons. Is that what happened to Brett Favre? I don't know, but from what he describes, it is likely. Now you've seen the link between concussions, CTE, and Parkinson's disease, and it's quite complex, and more research needs to be done. The evidence suggests that repeated head injuries can increase the risk of developing these conditions. It is crucial to prioritize brain health and take steps to prevent concussions. This includes wearing protective gear, following safety guidelines, and seeking medical attention anytime you think you have a brain or head injury. If you see somebody or know somebody who has experienced concussions, or you're concerned about long-term effects, it is important to consult healthcare professionals. Thank you for watching, and if you found this informative, please subscribe for similar content. So until next time, stay safe and stay curious.